This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet.
Aloha, and welcome to the monthly public presentation of the Vegetarian Society of Hawaii. Since 1990, the Vegetarian Society of Hawaii has been following our mission of promoting human health, animal rights, and protection of the environment by means of vegetarian education, as we've grown to become one of the largest all-volunteer, nonprofit vegetarian societies in the nation. Well, it's now time to introduce our special guest. We're delighted to have with us tonight Dr. Jeni Shull MD, MPH. Dr. Jeni Shull is a board-certified family and preventive medicine physician. She was born and raised in northern Indiana, where she enjoyed horseback camping and homegrown food. During this time, she also saw many family members become deathly ill from poor lifestyle choices. Her desire to see preventable diseases reversed fueled her career in medicine. She attended medical school at Indiana University and completed her residency in Family and Preventive Medicine at Loma Linda University, where she also obtained a Master of Public Health degree specializing in population medicine. As a resident, she served as chief resident 2 years in a row, won first place in a local competition for her research on hypertension and spirituality, and was awarded the 2015 Resident Teacher of the Year Award for her program. In October, she joined Dr. John Kelly at Black Hills Health and Education Center in South Dakota to become their first lifestyle medicine fellow. Upon completion of this training, Dr. Shull will be working at the Cummins Live Well Center, the Cummins Live Well Center in Columbus, Indiana, the largest occupation-based lifestyle medicine clinic. Her presentation tonight is entitled Neuroplasticity and the Brain-Heart Connection. Please join me in welcoming Dr. Jeni Shull.
I have to get my official Hawaiian attire. Well, as Lorraine mentioned, I am a substitute tonight, so I am not Dr. John Kelly. He is the one who originally put this lecture together, and I've had the privilege to work with him. So for those of you who have not seen Dr. Kelly before, this is a nice picture of him. He is an MD, MPH, and the founding president of the American College of Lifestyle Medicine and a trailblazer in the field of lifestyle medicine. A wonderful physician and a wonderful husband and father. So he's been a great teacher for me as I've been out there in the Black Hills. And even though Lorraine mentioned this earlier, I'm going to tell this in my own special way. So, is anybody a math major out there? Anybody like math? Okay, we got a few. Okay, so for you guys, I put together a little equation. So Sunday night, I had invited all of the Black Hills staff to go ice skating in Rapid City, and Dr. Kelly came along. Well, I didn't realize that when you add Dr. Kelly with children, particularly a 4-year-old little boy who cut him off, what kind of results you would get. When I added it up, the little boy did a little bit better than Dr. Kelly did, because Dr. Kelly ended up with a negative equation. Actually, he's minus a intact femoral head, but now he's positive one that's been surgically corrected. So he had surgery yesterday on a broken femoral hip. This is not his x-ray, so it's HIPAA approved. He actually made it through surgery just fine and is doing well and sends his regards. So he's got a lovely view from the 10th floor of Rapid City Regional Hospital, looking out on the rest of South Dakota. But I'm sure he is still thinking of us, or maybe giving us a little bit of thought while we're out here in Hawaii. Now, some of you may be thinking that I was the one that invited him. I happened to be there when the accident happened. I'm here in Hawaii, he's not. But sabotage was not a part of my plan, especially not the hip fracture. But thank you guys for being so welcoming here. I've really enjoyed what I've seen of your state already, which has been quite a tour, thanks to my chauffeur. And so tonight, I'm actually going to give a little different twist, put my own spin on the lecture, and I called it A Tale of Two Hearts, the chest heart and the brain heart. Really, the title should be Epigenetics and Neuroplasticity. Okay, no one seems real excited about that either, so I changed the title. Oh, we had one fan there in the back, great. So I didn't know if you guys were excited about DNA methylation or, okay, yeah, we got some head nods back there, or neural regeneration as I was. So this story starts in Black Hills Health and Education Center, and this is where I currently work. This is out in South Dakota. This is a lifestyle medicine center, so patients will come there and they'll stay for 11 or 18 days. During that time, they're put on a plant-based diet, which is a code word for a vegan diet, and they are also asked to exercise, not even very much, starting with whatever they can tolerate, but with a goal of 15 minutes of weightlifting a day at their level, and then also walking, starting out at whatever they can do with a goal of 2 to 3 miles. After 18 days, we've seen remarkable results. So actually, when I arrived, I got to be one of the patients, and these are some of my co-patients. They agreed to let me use this photo and tell some of their stories. As a resident, I would put people on cholesterol medication, and I would see their total cholesterol go down maybe 30 or 40 points over the course of months. And I never saw anybody with their diet alone drop their cholesterol very much, maybe 10 or 20 points over the course of 3 to 6 months. It was kind of frustrating. But here, yes, you can see my pointer. So this is Elreen. She was one of my co-patients. In 18 days, she dropped her total cholesterol by 60 points, which was a surprise to me. Probably not you guys, because you already eat and live this way, but I had never had a patient group change this much. And then Elreen, who was right next to her, she dropped hers by 40. And Marsha was our other patient. She was there for different reasons. But they all improved drastically and changed in inches in their measurements, their waist measurements, their arm measurements from the time that they came in. So it didn't take very long to see really big improvements. Well, this center is not the only one that saw results. Before Dr. Kelly moved to South Dakota, he worked at Rocky Mount Lifestyle Medicine Center, and this was in Virginia. During that time, they had run an intensive CHIP course, which is the Complete Health Improvement Project some of you might be familiar with. And they studied 162 patients very closely from when they had their program, which was 6 to 12 weeks, up to a year out. During that time, in a group that was an average age around 55 and a starting BMI between 30 and 40, they saw their BMI decrease over the course of 6 weeks to 12 weeks. They saw their blood pressure trends, so the beginning are in the dark colors. The beginning systolic is in the dark red and the beginning diastolic is in the red. And you can see all of these markers are going down as the program went on. Their fasting cholesterol dropped. Their fasting glucose dropped, and their exercise, which I love this one, those who were not exercising very much at the beginning, they almost all shifted to those who were really exercising. So this is just a course of 6 to 12 weeks where people were drastically changing their lifestyle behaviors. Their servings of foods with cholesterol, which is mainly going to be meat or dairy products dropped significantly, as well as their serving of sweets. High-fat foods as well. And then one of my favorite scores was their depression scores, or their short form scores, which is another way to measure mood or quality of life. So those that started out very severe down here, you can see almost, sorry, my computer's a little sensitive, almost completely normalized there at the end. So again, in 6 weeks or 12 weeks, they are doing what medications could not do, and those would be the SSRIs, which would be the main ones. And they only have a 30% effective rate, but this, we've almost touched 100% of the patients. So we know we can produce remarkable, dramatic improvements in chronic disease measured by changes in biometrics. We also know that unfortunately less than half of our participants sustain their improvements for more than a few months. And this is pretty frustrating. And so the reason for this? This might be that mysterious brain heart. So we'll come back to this in a moment. First off, does anybody remember the talk that Dr. Kelly gave when he was out here last time? Oh yes, you're cheating. Yes, it was epigenetics, for those of you who don't know, and this mouse has to do with it. Anybody heard of the agouti mouse before? Yes, okay, well, again, I got my same one person, my doctor over here. All right, so anybody know why I'm bringing up a mouse at a vegetarian conference? No. All right, we'll talk about that. So this mouse was specifically engineered to have, the one on the left for you guys, was specifically engineered to have the genes for diabetes, heart disease, and obesity. Does that sound like any population we know? Maybe the American public right now? So that's what they were trying to study, and they were trying to try out a couple different diets on the mouse model to see if they could figure out what we might do to reverse it or prevent diabetes, heart disease, and obesity from affecting people. And so they did. So this is the yellow mouse is the mother mouse, and the brown mouse is actually her baby. And what they did is they took a mouse that had known diseases for diabetes, heart disease, and obesity, and they fed her a healthy diet, low in fiber, low in fat, and it changed which genes were used in the baby mouse. So even though if we did a DNA study on the baby mouse would have the genes for diabetes, heart disease, and obesity, but it's not expressing them. And that's pretty remarkable. This was actually the first study that really changed the field of epigenetics and kind of opened the door to the field of, instead of we are our gene code, to maybe we have more choice in it. So let me explain the term epigenetics, because it's not really intuitive. So epi means close to, and genetics is kind of our genes. All of us have a DNA code. Everybody know that? All right, good, we're on the same page. So in that DNA code is a piece of information that tells us what kind of proteins we want to make for our cells. So those proteins will become pieces of our cells that eventually make our whole body. Now we actually have cells for our liver in our ear. Or we actually, have the same DNA code for our liver in our ear, but it's just not expressed there. Like I have cells, or I have DNA information in my fingernails for my teeth, but my teeth don't grow on my fingernails, and thankfully they don't. So there's a code that comes before which proteins are made or not made that says when to use this and when not to use it. And that's what they've discovered with epigenetics, is that with our lifestyle, we change the code that comes before that gene, whether to use it or to not use it. Now this is a whole nother talk, so if you're feeling a little overwhelmed, that's because you missed part 1 a couple years ago when Dr. Kelly was out here. But I'm just briefly kind of introducing the idea that there's kind of a light switch to our genes that turns them on whether we use them or turns them off. Everybody with me? All right, good, I see lots of head nods. So then they took an ordinary rat that wasn't very expensive at all, and they thought, well, this rat doesn't have the genes specifically for diabetes, obesity, and heart disease, but let's see if we can produce it. So they did. They fed the rat a really high-fat diet, over 50%. But you know what? When they've looked at kids' school lunches and what they're actually eating, kids are eating about the same. So when this rat had offspring, that the rat in adolescence started showing signs of increased blood lipids, early puberty, fat preference, so wanting to eat high-fat foods over healthier foods, and increased body weight. Does that sound similar to some of the children we're seeing today too? Yeah, so they were actually able to feed a high-fat diet and take a rat that didn't have these diseases and promote them. So again, they're changing the switches of which genes were used and which ones weren't. So we've looked at it in mice, we've looked at it in rats, and let's look at it real quickly in humans. So there was a study done by Dean Ornish called the Geminal Study, which is the short name for the gene expression modulation by intervention with nutrition and lifestyle. So I'm really glad they came up with Geminal to call it by shortly. It was a study done with 30 men that had prostate cancer at a low stage that opted not to get surgery or chemotherapy, or radiation, but to go on a lifestyle intervention instead. Again, the lifestyle wasn't really drastic. They didn't have to go run marathons. They weren't on a starvation diet. They were simply on a plant-based diet with a 3-day intensive introduction to the course, and they exercised. So again, it's not something the normal population could not do. What did they find at the end of the 3 months? Well, they had taken biopsies of the prostate tissue beforehand to look at the cancer cells growing and what genes were being expressed, so which epigenetic switches had been flipped, and which genes were actually being made, and they took biopsies at the end. So this is a heat map of which DNA or messenger RNA, which is a code that's made from the DNA, is being used, and so it gives us a clue into what genes are being made. When they started, this is the pre-intervention, the red or the darker color is the genes that are on, and the green or the lighter color are those that are off. They found over 450 genes were turned off or down after the 3-month intervention, and they found 50 genes were turned up. But what's even more incredible is that the 450 genes that were turned down were those that promoted cancer, and the 50 genes that were turned up were those that stopped cancer. So it didn't even take like 6 years for them to start reversing their prostate cancer. It took a simple 3 months of eating a plant-based diet, and they already started to see changes to which genes were being used on their DNA code. That gets me really excited because in normal medicine, we have to treat people with really harsh therapies, and we don't see the same results. And the side effects are that they also have lower cholesterol. They also have protection against heart disease. They also see better improvements in their pain or physical symptoms, increased stamina. So it's all good instead of the normal side effects that you'd get from chemotherapy or radiation. So with our choices, we can make a big impact. Excuse me. So this man here is Dr. Randall Jerdal. He's the one who did the studies with the agouti mice, the mouse that was yellow that we first started talking about. A quote by him, and I am going to read it because I think it is that important. He said, "Epigenetics is proving we have some responsibility for the integrity of our genome before genes predetermined outcomes. Now, everything we do, everything we eat or smoke can affect our gene expression and the future of generations. Epigenetics introduces the concept of free will into our idea of genetics." So this is very powerful. I've heard so many times from patients, oh, my dad had heart disease, I'm gonna have heart disease. My dad died of cancer when he was 50, I'm gonna die of cancer. Well, that's actually not true. They actually have free choice and they can do a lot to change their own genetic code. There's only about 3 to 10% of cancers that are linked genetically that have inheritable pattern that it wouldn't be stopped with lifestyle, and even that it would be helped, which is not very much out of the number of cancers that we have. So the key point, our DNA code does not determine our future. All right, so let's get on to the tale of two hearts. So we have this chest heart. Everybody familiar with that? Okay, it's pretty important, right? Yeah, we need it. Well, it beats over 3 billion times in a lifetime. Did you guys know that? And actually, it's some of the first fetal tissue identified with the naked eye. If it stops for a few seconds, we pass out. If it doesn't come back after those few minutes, we don't wake up. So we need our chest heart. Today they're doing some pretty amazing things, like heart transplants. You guys heard about those? Okay. Well, in a couple questions, I'm going to prove to you that this is not the most important organ in the body. And in fact, In just 2 questions, I think you guys will agree with me. So, how about, heaven forbid, you guys one day need a heart transplant. Would anybody in here be willing to get one? Nobody's willing to get a heart, okay. Yeah, I would be too. I would get a heart transplant if I needed it. If for some reason my heart quit working on me and they could give me a new one, and that was the only thing that was wrong, I would get a heart transplant. But, would anybody volunteer for a brain transplant? Why are you guys laughing? Well, I think it's because you guys realize too that a heart transplant is a donor heart, but a brain transplant is a donor body. So, someone else's brain in your body, you wouldn't be doing the thinking anymore, right? So that's why we're talking about the brain heart tonight and its impact on health and how it connects to epigenetics. So why would I call it a brain heart though instead of just the brain? I'm going to throw some quotes up here to kind of demonstrate that fact. This first one is from Helen Keller. "The best and most beautiful things in the world cannot be seen or even touched. They must be felt with the heart." Now, is she talking about the one that's beating in my chest? No, probably can't feel much with that one. Okay, let's try it again. Maybe that was just a fluke. Well, this is from a scriptural reference. "A new heart I will also give you, a new spirit I will put within you. I will take away the stony heart of your flesh, and I will give you a heart of flesh." Again, talking about the pumping heart. No, this is found in a part where it's talking about changing the minds or the behaviors of the Israelites. This is a quote from the Old Testament in the Bible. Okay, let's try another one. Confucius says, "Wherever you go, go with all your heart." Now this one's kind of a trick because you really can't go anywhere without your chest heart or your brain heart, but again, I think he's talking about where you go with all your mental capacity. And so the brain is amazing. It's where we think, it's where we feel, it's where we form attachments, it's where we process the input from the external world, and it's constantly making new connections. Medical science is exploring the labyrinth inside our craniums and unraveling mystery upon mystery. In fact, in medical school, it was told to me that the brain is the new frontier. So new machinery has even now come out that can actually read what you're gonna say before you say it. It's not that accurate yet, but it's getting there. Pretty incredible that our brains can be kind of calculated. And our brain, like I said, is continually making connections. Where the heart is continually pumping, our brain is continually taking in the information that we see or that we feel, and it's processing it. And those pathways that we use get stronger, and the other pathways that we use or that we're not using get weaker. So we knew all that in science. We knew that if you practiced, you got better, and if you didn't practice, that skill kind of went away. But there was a doctor who took it to a whole nother level, and that was Dr. Pedro Bach-y-Rita. He is an MD, PhD. He's held lots of different occupations and knows over 5 different languages. Pretty sharp. I hope to hear him speak someday. Maybe you guys can have him next year and invite me back. I'd like that. So he's been known to be the man who is able to connect anything to anything. And one of the ways that he demonstrated this is he was hired by NASA to make gloves that had special sensors on them that would then relay through the thick insulating that they have to have when they're in outer space to the fingertips that then went to the brain. He also does several contraptions that connect to the tongue, and we're going to talk about one here in a second. But he didn't start out thinking that he would go into neuroplasticity or be one of the leaders in the field. His story just started with his father, Pedro Bach-y-Rita, who at 65 had a stroke and was paralyzed on half his body and unable to speak. Well, Paul's brother, George, was a medical student at the time and was still living with Pedro. And so after the stroke rehab, which was for a normal 4 weeks, they brought him home, and he still was not able to talk, and he still wasn't able to move one side of his body. So George, not knowing any better, thought he would just start training his dad again like mothers started training infants. So he began having him crawl on the ground, and then began having him out in the garden and playing in the dirt, rolling marbles on the ground or balls back and forth. And what was crazy is that Pedro actually kept improving. So he eventually regained all of his function. He even was able to type again, which is fine motor movements. He remarried and then went back to teaching. He had been a professor beforehand, and then died 7 years later when he was hiking up in the some of the mountains in South America, in Colombia actually, from a massive heart attack. Well, his story was so incredible because most stroke patients don't recover all their function, especially after a month of being paralyzed. It's a pretty unique story. Sometimes they'll do it within a couple days, or with continued work therapy, they'll gain back some. So they figured, well, we should see what happened to Pedro's brain, and since Paul was in medical residency, he knew a physician that agreed to do the autopsy. And before I get to that, I wanted to pull up what we have thought in medicine is what our brains are like. So back in the 1800s, when they were first starting doing brain surgery, they would open up the person's skull and they would press on a part of the brain and then see which part of the body moved. And from that, they made a homunculus or a brain map. And it's kind of like we have road maps, we actually have brain maps. So this part of the brain usually works for your eyes, this part of your brain usually works for your arms, this is the sensation area, this is the speech area. We just mapped it all out, and we thought that it didn't change. So if you had a stroke and you destroyed that area, sorry, too bad for you, it's never gonna come back. So they expected, based on this information, to find that his brain must have regenerated to gain back that function. Well, when he did the autopsy, this is actually similar to what I found. This is not his real head CT. Anybody see anything wrong? Okay, yeah, there shouldn't be that huge black area in the brain. That's brain that's died and that's been damaged. And when they did the autopsy on Paul's dad, that's what they found. So he still had this huge area of necrosed tissue in his brain. And so that idea of the homunculus and that brain map being what was working was wrong. And so it made it made Paul start thinking, what else could have happened? And that's when he started his journey in neuroplasticity. So neuroplasticity really changes everything. Instead of thinking we're hardwired, like the homunculus taught us, that brain map, well, some people feel like they're hardly wired, but most of us are somewhere in between, and what we have is synapses or brain connections that overlap each other. And so when one arm is damaged, there may actually be a portion of those synapses that cross to another area where maybe the other arm is mapped out and functioning. And so what the brain has to do is rework a pathway to a healthy area in the brain and then get that function back. So brain real estate is sold to the highest bidder. So whoever's needing it the most is the one that gets that area in our heads. If we're practicing the piano a lot, more of the tissue in our brain is going to go to memorizing those notes or working on those fine motor skills. So it naturally does that. But what's even more important than just learning a skill like the piano or a new language, we're actually reshaping the pattern of our brain. It's not just like improving in an area or learning something new. We actually are changing synapses in the direction that they go. And this was thought impossible or not likely based off our brain maps. We didn't think that the left arm could be remapped over to the right side. Oh, I'm sorry. They cross in your brain. So we didn't think the left arm could be remapped to the left side of the brain to function. We thought it always had to be mapped on the other side. So continual remapping happens for maximum efficiency in our brain. So our brains are always looking for a way to make a process quicker and more efficient. So instead of replacing our brains, we don't actually need that brain transplant, although some of you might still think your spouse needs that brain transplant. What we really need is just to rewire our brains, and we can do that. So rewiring the brain happens not only after stroke, though. So I'm going to give you another example. So Dr. Bach-y-Rita, like I said, was a sharp man, and so he wanted to test this theory a little bit more. And he did that with the help of one of his patients, Cheryl Schlitz. So Cheryl, she had a bit of a problem with balance. When she had to go in for an emergent hysterectomy, she was given a certain antibiotic. And the antibiotic, which was gentamicin, got too high in her body and it actually destroyed the balance center in her brain. And scientists thought that about 95% to 100% of her balance center was completely destroyed and she'd never get it back. So the balance center is actually thought of as our sixth sense. We don't really think about it. We think of seeing and touching and hearing and tasting, but we don't actually think that us knowing where we're at in our chair is important until it's gone. And so for Cheryl, she lived in a world where she felt like she was constantly falling. Even if she was on the ground, she felt like she was still falling. Her movements were always jerky and shaky, and she had lived this way for over 5 years, had lost her job because it was so debilitating, and barely left the house. When she came to Dr. Bach-y-Rita, he said that he might have something that would work, and so she was willing to try it. She ended up having to wear something that looked like a construction cap with a whole bunch of electrodes in it that was hooked up to a sensor that laid underneath her tongue. And what would happen is while she wore this cap, the cap would be able to tell if she was standing upright or not, and then send that to sensors in her tongue, which then told her brain that she was standing upright or tilting to the side or sitting down, and it let her know where she was in space. First time I read this, I thought, that's pretty crazy. I didn't think that my tongue could do anything like that, but it's actually very sensitized and highly innervated, so it can read a lot of different signals. Well, when she first started trying this therapy and wearing the helmet, she put it on and she stood upright without having to hold on to anything. And she was able to do that for about 15 minutes after the cap was removed. Well, she kept coming back for treatments, and each time, the length of time that she was able to stand up afterwards without having to wear the helmet increased. A little more, a little more, a little more, until she was able to stand and function without having to wear the helmet and the sensor underneath her tongue. Well, what happened? Her brain rewired itself. The balance center had been 95% to 100% completely damaged, but her brain, by taking other sensory input that told it this information, was able to tell her when she was balanced or not balanced, even without a working balance center. Our brains are pretty incredible. And that's not the only thing it does. People born with syndactyly and fused toes, when it's first written in the brain as a toe, it wires it as 1 instead of 2, but they've been able to do this surgery and then put people through neuroplasticity training where they sensitize each toe or give a different stimulus, and then they'll look back at the MRIs and see that instead of that one pathway that had been originally there, that now there are 2 distinct toes that fire in the brain. They've also done this with webbed or fused fingers. And so my question is to you, are you willing to get that brain transplant, or are you willing to rewire? If you're willing to rewire like I am, well then how do we do that, right? That's the next question. We all want to function better, and I know that I have some neurons that misfire every now and then and could use some help. So if you guys are interested in that, we'll go over a couple key things that need to be there. So number 1 is focus. To give yourself the best chance at regenerating, but actually changing those synapses that are in your brain, you've got to focus. And so 60 to 90 minutes most days of the week on a certain activity. So it takes some effort. It's not something you can just do here or do there and expect to get results. It's similar to our diet. If you make major changes, you're going to see major changes. If you make little, you're going to see little. Learning, it requires doing something new. This isn't, I was born into a family that speaks in English. I work on my English. I get better at my English, but that's not actually going to generate new pathways. It's just going to improve old ones. I've got to really stretch myself. So maybe it's picking up French, or maybe it's picking up Spanish, or maybe it's picking up piano, something that I have not been able to do before. It's really got to stretch me as a skill, so I'm having to force myself. Next thing is all of that learning and all of that focus, it has to be taken from our short-term memories and put into our long-term memories. And when does that happen? It happens in our sleep. So that's especially those deep stages of sleep. Stage 4 and REM sleep is really when memory gets transferred over and our cells in our brains get to regenerate and refuel themselves. So it's very important to get good sleep with a goal of 7 to 8 hours a night for most adults. After that, food, right? This is the Vegetarian Society of Hawaii, so we've got to bring food in there. Proper feeding of both the brain and the body. Just like the patients that I talked about earlier that Dr. Kelly had worked with in Virginia, all of their depression scales changed and all of their quality of life changed simply by changing what they were eating and getting exercise. Food has a big impact on the way that we feel and the way that we can function. Again, with epigenetics, it literally tells our bodies which genes to use and which doesn't. So the food that you eat really becomes who you are. We are what we eat. The next thing is a clear conscience. And to some of you, this might seem a little out of place, but what it does is when we have things that weigh heavily on our mind, it takes our brain energy and it fuels it all in that direction. We're not able to use it on the things that we're trying to learn. So this might require things like meditation, mindfulness, forgiveness, working on being present, nothing to distract, and getting rid of guilt. So it may take some work, and this is going to be by choice. To some of us have to work on this more than others, but getting to a place where we're guilt-free in our minds, we have a clear conscience. And then lastly, we need optimal circulation. We need optimal blood flow in our bodies. And this requires not having cardiovascular disease and having good cardiovascular fitness. So when I need my heart to pump, it's pumping well and it's pumping out all the blood that I need. And what I think is, this also comes back to epigenetics. So if you're going to eat a certain way, you're going to flip certain switches, and that's going to keep your heart healthier. It's going to keep your body better oxygenated. And exercise. Exercise is the other very important component of that one. So coming back to the real meat of this talk, which is neuroplasticity and epigenetics, I want to kind of consolidate things, or kind of go over everything together with you guys. So number one, we don't need to transplant, we need to rewire. And what's awesome is that we actually can. Some of us have had things, bad habits, certain people that just kind of tip us off, and it feels like it's like someone pulls a ripcord and you go down a slope that you don't mean to go down every single time. Well, the good news is we don't actually have to do that. Even if someone's had a behavior that's ground in for 30, 40, 50 years, that doesn't have to be their future. They can actually stop that action and start making conscious decisions to head down a different path. It's going to be very difficult at first, but it can happen. So one, we need to start rewiring. And this is not just, again, changing a bad habit, but it's literally changing our brain. Two, as we continually make these healthier choices, we not only form new synapses in our brain, we start changing the epigenetic switches on our DNA code, which start changing the switches that our children will be born with, especially for women. When women carry a baby girl, that baby girl's eggs are formed inside her as she is inside her mother's womb. So it's the mom who's carrying the baby, and then also the eggs that will become her grandchildren. So what that mother is eating affects her child and affects her grandbaby, or her granddaughter specifically. Men will form sperm later in life. But the choices we make not only affect us, but they'll affect the genetic switches that our next generation is born with. Third, our epigenetic switches are flipped as we start to change. Our body turning off genes that we don't need and turning up genes that we do need. So when we saw this in humans, so it can be done in 3 months' time even. Didn't take very long. And then when you have that neuroplasticity occur, and then you've got the epigenetic changes that are happening, the end result is life change. Little did the patients and I know when we started in October that the sneaky plan was actually to transform our brains, but it worked. And I think that's part of the reason that we all have stuck with it since we finished. There's things that we do that get us heading down a different path, and that literally, we've changed our decisions, we've changed the way that we live, and that literally starts to change what we're made of. Pretty amazing. And lastly, the more we practice these behaviors, the stronger the synapse forms in our brain. So it's kind of like a if someone stood on a hill of dirt and they poured a bucket down, you're going to form a pathway with that water. Well, the more water you're going to pour on that pathway, the deeper that ravine is going to be. The same thing with our synapses. When we use one over and over and over again, it gets stronger and stronger and stronger. And this can be detrimental, and we've all seen that happen in people, but this can also be beneficial. So you have to work less and less and less at those healthy behaviors. Just like Cheryl, the one who had the balance problem, at first she could only stand up for 15 minutes, but the more that her brain was able to transform itself and form those new synapses, the less she needed the sensor telling her what was going on, and she was able to function without it entirely. So that ends the tale of two hearts. I kind of want to open it up for questions at this time. Thank you guys very much. Thank you. I see a question there in the back. Oh yes, the medication was called gentamicin. It's a common antibiotic, but what had happened in her is that the doses had gone dangerously high and it had damaged her ear. Yes? Okay, great question. So the question was, is there other things besides balance or the stroke that I talked about that rewiring is used for? And the answer is yes, there's a lot. So they've looked at children with learning disabilities, children that have been born with brain defects, like missing a part of their brain. They have looked at people who have lost a limb and they have that phantom pain syndrome or that phantom limb syndrome, and they've done neuroplasticity work with that. They've also done it with people who have very bad interpersonal relationships or who have suffered abuse and then are having trouble reconnecting with individuals. The best source to find, or the best kind of introduction to this, would be a book called The Brain That Changes Itself by Norman Doidge. So that's D-O-I-D-G-E. And through that book, I think it's around 200 and some pages, he just goes through example after example of neuroplasticity and how it's being used. Neuroplasticity in Alzheimer's was the question. And so give me a second to think about this because I want to say it correctly. What they've done is they've shown that people who are learning new skills and who are eating a plant-based diet have more protection from Alzheimer's. I don't know if I can speak specifically to someone who's had Alzheimer's and they've done therapy and they've come back from that. So it's more so in the preventing the brain degradation than restoring it after that Alzheimer's has started. But that doesn't mean it's impossible. This was supposed to be impossible a couple years ago. Sorry, I don't have a better answer. I can try to look up something for you if you see me after. The question was, is people that have suffered abuse in the past, some of the treatments that they had done, and I'll go ahead and speak to that. Some of them are very individualized. It's a lot of psychotherapy, so a lot of talk counseling. But what they would do is instead of looking more so at a victim personality, reshaping or victimizing, like I'm a victim, this has happened to me, looking at it as a survivor, and then having people work through it. It's not easy. Part of it was kids that had undergone sexual abuse as children, and Dr. Doidge himself is a psychiatrist, and so he spoke more specifically from his experience with it in the book. Most of it was still counseling. They didn't do specific exercises with it. It was more sitting down and working through with it. But instead of, again, going down a same pathway and having so like for a woman, let's say she had been abused by a man, instead of every time she saw a man feeling intimidated or something like that, they'd start working with her, okay, you're gonna start holding this posture. So it's somewhat of what we do already in cognitive behavioral therapy, which I think is why it's effective, kind of reframing things as well. And then again, some of this just takes time. Yes, so did that answer and somewhat not. Yeah, I think everyone's very individual on that. Most of what I've read is it's still mostly talk therapy at this point. So the question was, when we sleep and the brain has different areas that it takes information and shovels it and then makes it the long-term memory, the question is, where does that happen and how does that happen? And it's a great question. It does happen when it comes in. our memories will be formed in our amygdala, and then our short-term memory is held there for just some amount of time, like for a day. And then when you sleep, some of that information will go into the, I'm not gonna mess this up, the gray matter of our brains, and then it's held there. And then the more that pathway would be used, the more that that memory would be present, or we'd be able to go back to it. Now, some things can be very traumatic, and they form a really deep synapse right when they happen, and that's usually when there's an emotional connection with it as well. So it's kind of here in our temporal lobe and then our parietal lobes that some of that memory making and formation is happening. The question was, does the brain lose its ability to be plastic when it's older? And it's kind of a yes-no. So no, in that sometimes there are people who have, they're like 3 or 4 years out from the stroke, and when they try to do the neuroplasticity exercises, which is mainly restricting the good side and forcing the bad side to move in stroke recovery, they found that they have not been able to, some of them still don't recover. But I think what we have found is that we used to think only children could really bounce back and that they were very plastic. But as Dr. Bach-y-Rita's dad was 67, and he bounced back. So I don't think it's ever too late to try. And I think that there is so much more plasticity to our brains in old age than what we have ever given it credence. So maybe if the injury is several years out, it would be hard to regain that function. Or like Alzheimer's, if they're already diagnosed, to have them come back. Because some of that really is destroyed, and we haven't found a way around that yet. But especially if it's a more recent injury, I would say giving neuroplasticity, and there's some centers specifically in the southeast that are doing more stroke recovery with neuroplasticity, restraining of the good side, that has been very effective in very old patients. I know there's some here in the back, so I'm going to come back over here.
Well, she had her hand up for a while.
Oh, okay. Then that was very nice of you. Yes.
Here's my question. If you are what you eat,
Yes.
your proteins help determine the DNA of your cells.
Yes.
Right?
Well, oh, sorry. I think that might be. Well, go ahead and finish your question.
Yeah, I wanted to check that back. If people eat animals, and the animals have animal DNA, by some of this research, do people become more animalistic? How would we describe animalistic? Maybe more reactive, and also maybe using more the limbic brain rather than the cortex?
Okay, so the question was, when people eat animal protein, does their DNA then become incorporated into ours in a sense, and then we become more animalistic? So my short answer, I'm going to kind of cop out on this, is that I am not aware of animal DNA being incorporated into our DNA at all. I am aware of that when we do eat animal protein, some people do react stronger to it and causes a state of inflammation in our bodies, where we are more prone to diseases, heart disease specifically, and arthritis and pain. When you don't feel well, you also don't act well. There's probably a lot more research out there than that. That will be my short answer. So I don't think we become animals. When I say we are what we eat, when we eat certain foods that are high in saturated fat, or high in total cholesterol, or just excess calories in general, it causes our bodies almost to start self-destructing in the DNA, and it promotes stages of inflammation or promotes stages of increased growth of certain cells. And the proteins don't become the DNA. The DNA code is written in each cell and is in each nucleus, but how it's read is the epigenetic. It's kind of the switch that says open this door, don't open that door. And when the switch is turned on, then a protein is made from that code in the DNA. So the proteins are made from the DNA code, and not the DNA code made from the proteins. So the question was, her niece has seizures, would neuroplasticity be an option? And I have not done the specific research on seizures and neuroplasticity, but I would recommend getting the book, The Brain That Changes Itself, because there is a chapter in it that talks about childhood illnesses, and it does mention seizures. So I think that there could be help from it. and working through that and trying to find out where that foci is. There's lots of causes for seizures, and so you may still have to work with the doctor, but I think learning about this information would always be helpful. Okay, this is a great question on sleep. The question is, how much sleep do we actually need? Is there a time during the day when it's better, specifically for shift workers? Did that cover it all? Okay. And that is a great question. So right now in the American society, it's like macho to be able to go on 3 or 4 hours of sleep and still function the next day with your cappuccino in one hand and your donut in the other. But that's actually not healthy. So when people sleep less than 5 hours of sleep, we've been able to correlate that with shortened lifespans. And what we're finding is that most adults need to sleep between 7 and 8 hours. When they start sleeping more than 9 or 10, it might actually be detrimental. So there's kind of a curve, a perfect medium in there. That being said, some people do sleep naturally longer than others. As far as a certain time during the day, the reason that we can kind of initiate sleep is from a host of chemicals, one of those being melatonin. When we're out in the sun, especially in the afternoon, or get morning sunlight, it helps our melatonin regulate. Melatonin helps us fall asleep then when dark comes on and kind of that cool in the day. And so it is best for our natural rhythm, our circadian rhythms, to sleep during the night instead of trying to sleep during the day. Now, shift work is a part of life, so the more that you can mimic actual day and night for yourself if you are a shift worker by buying like a bright light, one of the sleep lights to help wake you up first thing in the morning and come on gradually, or bright blackout curtains, better. But we do see shortened lifespans with people that work shift work. So the question was, a couple years ago, her niece, who was younger, 57, had a stroke after a procedure, and how would she start doing some of the neuroplasticity exercises? Well, as I mentioned, I'll get you the name of one of the doctors that's doing this in the southeast of the mainland. What they do is they do restrictive therapy. So they stop the good arm from moving at all, and they try to do this as soon after the incident as possible. And then they start having the person even imagine them doing the work with their bad hand. And there's something about imagination that's very powerful. When they've done studies with this and they've had people practice the piano in their head, those that imagine they practice versus those that did not practice at all, when they both had to sit down and play the piece, those that imagined it were much more proficient. So even starting with imagining moving your arm and moving those muscles will start waking up that side of the brain again. And I would start there, and then they start having them do whatever they can, and then just using that weak arm as much as they can instead of the strong side. And then come and see me afterwards, and I'll get you the name of the doctor that's working in the southeast. Okay, I had a question from up here in the front. How can we affect or reduce inflammation in the brain? Well, the way that we reduce inflammation in the brain is the same way that we reduce inflammation in our body. And it's not neuroscience, it's what you guys are doing already. You eat a whole foods, plant-based diet. You let the antioxidants from the foods, the living foods that you're eating, help calm your own bodies. When you're not eating animal proteins, you're not getting as much of the inflammation along with dairy products or eggs. And your body's able to, plant proteins do not cause our bodies to be as inflamed as what animal proteins do. Plus, some people might need to do stress reduction. And then some people may need to start sleeping more and sleeping for the length of time that they need. And then other things would be exercise, getting appropriate amounts of exercise. So those things make a big difference. And like Mrs. Bragg was saying, getting fresh air and living a good life, it makes a big difference in all of those things in reducing inflammation. How important is REM sleep? REM sleep is very important. It's part of the process where we're transferring that short-term memory into our long-term memory. So it is very important. And certain medications, like sleep medications, will actually stop our bodies from getting there, which is pretty dangerous. Okay, good question. So the question was, how does coffee and wine affect you, and is it better to have organic if you were going to have it? To start off, I think anytime that you can have organic versus non-organic, it's better just because you're going to decrease the pesticide load in your body. That being said, if it's the choice between a McDonald's hamburger or a non-organic apple, choose the apple, okay? So some people can spend more money on that. Other people, I just want them to start eating anything that's not deep fried. When it comes to wine or coffee, so grapes have a thin skin, so if you're gonna, and then a lot of times they'll be heavily sprayed. If you can find some organic wine, that'd be great. There's resveratrol that's found in grapes that has been helpful in heart disease, that they have found in moderate or in alcohol. But that being said, as a physician, I never prescribe anyone to drink wine because there's a lot of deleterious effects that happen from alcohol as well. So if someone's drinking it and they want to drink it for some health benefits, a glass at max 2 for a man, or a glass a night for a woman, at maximum 2 for a man a night would be the most that I'd have you do. If you're not drinking, I would not advise you to start. There's supplements where you can get those antioxidants, and you don't need to drink to get them. When it comes to coffee, there have been some studies that show that coffee can help prevent things like diabetes. There's also a lot of studies that show coffee is really linked to insomnia and more anxiety and high blood pressure. So if you have no anxiety, you have no high blood pressure, and you're not having any trouble sleeping, maybe coffee's okay for you. If you do fall into the other category, maybe coffee's not so good for you. Yes, there are exercises that neuroplasticity can do for depression. And I think, again, it's kind of like what they do with abuse. Instead of going down certain pathways in our brain that are really well wired, it helps getting people to think a different way. And they have to actively start choosing to think a different way, but they can form different pathways. Now, there's sometimes where there are health conditions that might be causing the depression underlining, or even some medications, and those, the underlining cause would have to be treated. But yes, I think that people can start working with different, they can start challenging their brains more, they can start exercising more, which would be really, really helpful for depression, and eating right. And in that combination, you're gonna be switching your epigenetic switches, and you're also gonna be forming new neural pathways. Okay? Yes. All right, well, thank you guys. It's been a pleasure to be here. Thank you. Thank you. You guys are very nice.
Thank you very much, Dr. Jeni Shull, for this amazing and really excellent presentation. I don't know about you, but I learned a lot. And thank you again for coming. Mahalo, and have a safe return home, everyone. Good night.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. 3 monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.